Did you know that about 8% of babies have food allergies and many of them go undiagnosed? That's right. These hidden food allergies can lead to serious health issues if they're not caught early. Babies can't exactly tell us when they're feeling uncomfortable, so it's up to us to look out for signs that something might be wrong. In this video, we're going to dive deep into the hidden signs of food allergies in babies. Some of these symptoms might surprise you because they can seem like typical baby behaviors or even minor issues that you wouldn't think are related to food at all. So, whether you're a new parent, a caregiver, or someone interested in baby health, stay tuned because you won't want to miss this. Hey everyone, welcome back to the channel. Today, we're talking about an important topic: recognizing hidden food allergy symptoms in babies. Catching these signs early on is essential for keeping your little ones safe and healthy. So let's jump right in and explore what to look out for. When it comes to identifying food allergies in babies, it's not always straightforward. After all, babies can't tell us what they're feeling, so we have to rely on physical signs and changes in their behavior. Sometimes, food allergy symptoms are very subtle, or they show up in ways that might not seem related to food at all. This can be confusing for parents because they might not make the connection between their baby's discomfort and what they're eating. For example, a small rash might be mistaken for baby acne, or tummy troubles could be blamed on teething. It's easy to brush off these small things, especially if they don't seem severe. But sometimes these little signs are the first clues to a food allergy that's just beginning to show. For many parents, it can be a tough journey trying to figure out what's bothering their baby. You might find yourself visiting multiple doctors, looking for answers, and feeling frustrated because you know something isn't right, but it's hard to pinpoint the cause. And because babies develop so rapidly, you might even see symptoms come and go, making it even harder to tell if there's really an allergy at play. Plus, some food allergy symptoms don't show up right after eating. They can take hours or even days to appear. This delay can make it difficult to connect the reaction to a specific food, leading to confusion and sometimes even a misdiagnosis. So, what are some of these hidden symptoms we should be on the lookout for? One of the first and most common clues is skin reactions. A lot of parents don't realize that food allergies can show up as skin problems, but this is actually very common. For example, if your baby has eczema or red, itchy patches on their skin that just won't go away, it's worth paying attention to. While eczema can have many causes, for some babies, it's a sign of a food allergy. Other skin reactions include hives, which are small, red, raised bumps on the skin that can appear suddenly and usually feel itchy. If you notice hives appearing shortly after feeding, that's a strong indicator that your baby may be allergic to something in their diet. Even if the rash or eczema doesn't appear immediately after eating, it could still be linked to a food they consumed, so it's important to keep an eye on any persistent skin issues. The next group of symptoms is gastrointestinal issues, which can also be easy to overlook. Babies often have tummy troubles, so it's understandable that parents might not immediately think these are due to a food allergy. But if you notice that your baby has frequent diarrhea, vomiting, or excessive gas, these could be signs of an allergic reaction. For example, if your baby consistently has diarrhea or loose stools after eating a specific food, it could be a sign that their digestive system is reacting to that food in an allergic way. Some babies may also experience constipation or abdominal pain, which can show up as fussiness, crying, or pulling their knees up to their chest. These symptoms might come and go, making it difficult to identify the pattern, but if you see them occurring regularly, it's definitely something to talk to your pediatrician about. Another hidden symptom of food allergies in babies is related to their behavior. Babies who are dealing with discomfort from an allergic reaction may become unusually fussy, irritable, or have trouble sleeping. This might not seem like an obvious sign of an allergy, but for some babies, allergic reactions can cause physical discomfort that leads to mood swings or changes in their sleep patterns. If your baby suddenly becomes extra fussy after meals or has a hard time settling down at night, it could be a clue that something in their diet is causing them discomfort. As parents, we know that babies can be fussy for all sorts of reasons, but if you notice this happening consistently after certain meals, let me share a real-life example that illustrates just how important it is to be aware of these hidden symptoms. There was a baby named Emma who seemed perfectly healthy. She was a happy baby for the most part, but her parents started to notice that she would get a rash every now and then and seemed extra fussy after meals. At first, they brushed it off, thinking it was just normal baby behavior. But one day, after trying a new food, Emma had a severe reaction. She broke out in hives and had trouble breathing. Her parents were understandably terrified and rushed her to the doctor. It turned out that Emma had a peanut allergy, and her body had been reacting to even trace amounts of peanuts that she'd been exposed to through cross-contamination. The earlier rashes and fussiness had actually been warning signs that her body was sensitive to peanuts. This story really shows why it's so crucial to be aware of even subtle signs and to trust your instincts as a parent. If something feels off, don't hesitate to get it checked out. Now that we've talked about some of the common symptoms, what can you do if you suspect your baby might have a food allergy? The first step is to keep a close eye on their diet and any reactions that follow. A helpful tool is a food diary, where you can jot down what your baby eats and any symptoms you notice afterward. This can make it easier to spot patterns and share this information with your pediatrician. If you see that certain symptoms consistently appear after eating specific foods, this can be a strong indicator of a potential allergy. When you talk to your pediatrician, they might recommend an allergy test. There are different types of tests, including skin prick tests and blood tests, which can help determine if your baby is allergic to certain foods. For young babies, doctors may sometimes suggest an elimination diet, where you temporarily remove suspected foods from your baby's diet and see if symptoms improve. This approach can help confirm if a particular food is causing a reaction. However, it's important to do this under the guidance of a doctor to ensure your baby's nutritional needs are still being met. Managing food allergies in babies can be challenging, but with the right approach, you can create a safe and healthy environment for your little one. If you find out your baby does have a food allergy, the next step is to learn how to avoid the allergen and recognize the signs of a severe reaction. In some cases, your doctor may prescribe an epinephrine injector, which can be used in case of a serious reaction. It's also helpful to educate family members, caregivers, and others who might be around your baby about the allergy so they can take precautions too. So, to sum it all up, we've covered a lot of information about hidden food allergy symptoms in babies. From skin reactions like eczema and hives to gastrointestinal issues and changes in behavior, these are all signs to keep an eye on. Remember, you know your baby best, and if you sense something's off, it's always worth checking out. All right, folks, now it's your turn. Have you ever noticed any hidden symptoms in your baby that turned out to be a food allergy? If so, please share your experiences in the comments below. Your story might just help another parent going through the same thing. And if you found this video helpful, don't forget to give it a thumbs up and share it with other parents who might need this info. Also, check out our other videos on food allergies and baby health for more tips and insights. Thanks for watching, and we'll see you next time.